Hello, you're welcome to the channel. This is First Time Moms. I'm Dr. Rabo, and this channel focuses on common questions, common challenges new moms and expectant moms are often faced with. And today we're going to be talking about painful breastfeeding. Is breastfeeding supposed to be painful? Is it something we should be scared of? Is it something we should run away from, right? So these are the things we're going to be discussing in today's video. And if it's something you're interested in, let's dive right into it right away. So painful breastfeeding. Well, it can be scary when you see, when you see that something that ought to be a time for you to nourish your baby, nurse your baby, get to know your baby better, time to bond with your baby, can sometimes become a nightmare in the sense that you're seeing your baby is crying to feed, and you're also scared. It's not because you don't love your child, it's not because you don't want to breastfeed your child, but each time you put baby to breast, you have this excruciating pain. Sometimes you see the mom crying. It is actually something no mom should experience, and unfortunately it is the reality of many new moms. This is what this video is going to be addressing today. So when it comes to breastfeeding, ideally, naturally, all things being equal, all things being okay, breastfeeding ought not to be painful. As unrealistic as this may sound, it is the truth. Breastfeeding ought not to be painful. If breastfeeding becomes painful, it means there's a problem. It means there's something going wrong, and that thing needs to be addressed. If it is not addressed, you're going to suffer, you're going to feel pain, you're going to start crying, you're going to start dreading breastfeeding. Breastfeeding is actually designed by nature for mothers and babies to bond. That is the time to nourish your baby. That's the time for you to, bond with your child, enjoy motherhood, nurse your baby and all of that. That is the whole essence of breastfeeding. Your baby is going to be getting optimal nutrients for you to nurse your baby, nourish your baby, get to know your baby, bond with your baby. Basically, that is what breastfeeding does for you. But by the time it becomes painful, it is something that can become a nightmare. So becoming a mom and you're having this fear of breastfeeding, adding to the stress of motherhood alone, it is too cumbersome, and it is not something any mom should actually experience. So what is now the cause of painful breastfeeding? The most common cause of pain when it comes to breastfeeding is poor latching. If the latch is wrong, latching simply means how you position your baby to your nipple, how you position baby to your breast. That is basically what latching does. And when the latching is wrong, that alone can cause excruciating pain. It's not just about the pain, it cracks, and before you know it, you're having breast abscess, you're having pus coming out from your breast, and really it's actually a cascade of event that can lead to another worse event if care is not taken, if it's not handled on time. That's when you now start hearing things like, oh, I'm having mastitis, I'm having breast abscess and all of that. So it's not just about the pain. Aside the fact that this pain can be excruciating, this pain can lead to a lot of things, to cracks in the nipple, to mastitis. Mastitis can lead to abscess. You now see that they're bringing pus out of the woman's breast, and no mom should actually experience that. When it comes to painful breastfeeding, the most common cause is the poor latch. If you can correct the latch, most of the time, this breastfeeding ought not to be painful. If after correcting the latch, it is still painful, then other factors need to be checked. But most commonly, this poor latch needs to be corrected. And how do you latch? It is very, very simple. Sit in a very, very comfortable position. Put baby in a way that you're very comfortable, and put baby to breast. We're going to be coming to positioning later. How you ought to position yourself as a mom so you don't end up with aches to neck pain, body aches and all of that. I'll come to that. But when it comes to poor latch, how do you correct that? Simply position your baby in a way that when you open your baby's mouth, the baby's lips are around the nipple and the skin around the nipple, the brown skin around the nipple. Baby should not be positioned in a way that baby is just sucking on just the nipple. That is what causes the pain. So you need to avoid that. When it comes to latching, get the latch properly in the sense that baby is positioned in a way that when baby opens the mouth to latch on the breast, we position it to start sucking. Baby's mouth and the lips are around the nipple and the skin, the brown skin around the nipple, as you can see on the screen. This alone can reduce most of the pain most new moms experience during breastfeeding. And this is usually common amongst first-time moms because first time experiencing childbirth, experiencing to nurse. So most of these things can become new and all of that. So you can start practicing with your baby. So when baby is not too hungry, you can position your baby in a way that baby is not so anxious to just eat and they're trying to rush on the nipple and all of that. Baby is kind of calm. can practice with your baby. Put your baby close to the nipple. When baby opens the mouth, ensure baby is not just stopping around the nipple. Ensure baby's lips are both around the nipple and around the skin. That's the areola around the skin surrounding the nipple as well. This is so important. Well, how about positioning? Because aside the poor latch, sometimes new moms end up with body aches, end up with, you have this generalized body pain after breastfeeding. Sometimes you even need a massage. So how do you prevent that? It's important to position yourself very well. Do not just slouch when you're trying to breastfeed as much as possible. You want to sit erect. Even when you want to even relax your back, ensure you relax properly. Not that your spine and everything is just, scattered in a way that you're not comfortable. So it's very important you're comfortable, and it's important you bring baby to breast. Do not curve and meet your baby. When you curve and meet your baby, you're going to be straining your muscles, straining your bones. Do not do that. So bring baby to breast. That way, baby is coming to meet the breast and you're more comfortable. That alone can prevent the neck pain, the body aches, and all of that, the back pain. All of that can be reduced. So when it comes to pain during breastfeeding, correct the latch. When the latch is done correctly, most of this excruciating pain will be gone. So when it comes to breastfeeding, ensure the latch is done correctly, ensure you position your baby correctly, ensure you're also well positioned each time you're breastfeeding so you do not end up with all the aches, all the pain and all of that. And most importantly, you do not end up having excruciating pain during breastfeeding, which can prevent you from breastfeeding in the sense that whenever baby wants to breastfeed, it's like you're becoming scared, you're becoming worried, you're becoming anxious. No, we do not want that to happen to you as a new mom. So ensure you correct the latch. So this is what I have for you today. See you in our next video. Until then, remain fabulous and remain